Ulcer pain relief. At times, a person may have an ulcer in the throat, esophagus, or voice box that can cause problems eating, drinking, chewing, swallowing, or talking. Many things, including chemotherapy and radiation, fungal, bacterial or viral infections, cancer, stomach acid reflux, and other conditions that cause inflammation and irritation can cause these ulcers. Ulcers may develop in the throat, esophagus, and the voice box as a result of many conditions and causes. Fast facts on throat ulcers. Treatment and management of throat ulcers will depend on what is causing them. Prognosis is typically good, especially for those who take their medications and follow their recommended diets. The pain caused by the ulcers can lead to a range of symptoms, such as difficulty eating, drinking, chewing, swallowing, or talking. Causes. Ulcers found in the throat may be related to or caused by certain chemotherapy or radiation treatments for cancer, bacterial infections, fungal infections such as thrush, which is a yeast infection caused by Candida albicans, viral infections, such as herpangina, mouth blisters, and hand, foot and mouth disease, which are caused by Coxsackia virus. Conditions such as Behçet's syndrome, which is an inflammatory disease that causes ulcers to form in the mouth, genitals, and other areas of the body. Cancer ulcers found in the esophagus may be related to or caused by conditions such as gastrointestinal reflux disease, GERD, the use of certain medications, such as non-steroidal anti-inflammatory drugs, NSAIDs, bisphosphonates, and some antibiotics. Infections such as Candida species, yeast, herpes simplex virus, HSV, and HIV. Overconsumption of acidic foods, such as those containing citrus and vinegar, and drinks containing caffeine and alcohol. Ingestion of corrosive agents, such as ammonia or sodium hydroxide. Chemotherapy or radiation treatments for cancer, mucositis, excessive vomiting. Allergies. Ulcers or granulomas found on the voice box may be related to or caused by conditions such as injury from intubation, where a tube is passed down a person's throat into the trachea to aid in breathing. Laryngopharyngeal reflux, an inflammatory condition caused by GERD, where stomach acid gets into the lower throat and voice box. Excessive coughing or use of the voice. Cancer. What are the symptoms? Symptoms associated with throat ulcers may depend on the underlying cause and include a sore throat, fever and chills, joint pain, difficulty swallowing, pain with swallowing, stomach acid, regurgitation, chest pain or burning, heartburn, feeling as if there is a lump in the throat, nausea, vomiting with or without blood, choking sensation, voice changes, frequent coughing or clearing throat, taste changes, acidic or bitter or sour taste in mouth, smelling changes, ear pain. Diagnosis. In the first instance, doctors will do a physical exam and evaluate a person's symptoms. They may then need to take throat cultures, using mouth swabs. Sometimes blood tests and urine tests may be required. However, diagnosis of throat ulcers will depend on the suspected cause of the condition and may include barium swallow X-ray, to evaluate for esophageal narrowing, hernias, or mass lesions. This is done by drinking a barium liquid solution that coats the lining of the throat, esophagus, and stomach. Esophageal endoscopy, to evaluate for abnormalities in the esophagus by using a lighted camera that is placed in the esophagus. Biopsies or skin samples may be taken at this time. Laryngoscopy, to evaluate the larynx and hypopharynx, area of the throat where the pharynx and esophagus meet behind the larynx, using a fiber optic camera or small mirrors. Laryngeal videostroboscopy, to evaluate the vocal cords and voice box with strobe lighting through a laryngoscope and video recording. Panendoscopy, to evaluate the mouth, nose, throat, including the larynx and hypopharynx, esophagus, and trachea for potentially cancerous tumors. Other imaging tests. These may include a computed tomography, CT, scan or a magnetic resonance imaging, MRI, scan. In some instances, especially if a doctor suspects cancer, they may recommend a positron emission tomography, PET scan. How is it treated and managed? In some cases, simple lifestyle modifications may be all that is necessary, and these will be discussed in the section below. However, some types of throat or esophageal ulcers require more extensive medical attention and people should discuss treatment options with their doctor. Treatment of throat ulcers may include medications such as antivirals, antibiotics, and antifungals, pain-relieving medications, such as acetaminophen, available for purchase online. Prescription mouthwashes containing medications such as the local anesthetic lidocaine. Treatment of esophageal ulcers may include antivirals, antibiotics, antifungals, or antiparasitics. Medications to reduce stomach acid production or activity, such as over-the-counter or prescription antacids, H2 receptor blockers, or proton pump inhibitors. Antacids are also available for purchase online. Medications to make the stomach empty faster. Glucocorticoid therapy. Surgery in some situations. Treatment of vocal cord granulomas may include removal of the endotracheal tube. Vocal therapy. Medications to treat stomach acid reflux. Sometimes surgery may be warranted. Home remedies. Lifestyle changes and modifications that can be made to treat and manage the symptoms of throat ulcers may include avoiding acidic or spicy foods, mouthwash or drinks containing alcohol, and tobacco. Smoking. Eating soft, creamy, and mild foods, such as cheeses, mashed potatoes, and yogurt. Avoiding rough and hard foods, such as chips, nuts, and some fruits and vegetables. Rinsing mouth or gargling. Do not swallow, with a mixture of water, salt, and baking soda. Eating and drinking lukewarm or cold foods and drinks. Frozen fruit or ice pops may be soothing. Eating sour cream before each meal to coat the mucous membrane. Staying hydrated by drinking small amounts of liquids throughout the day. Reducing risk for GERD by maintaining a healthy weight and avoiding irritating, acidic foods, including tomato-based foods, citrus, mint, and chocolates. Avoiding eating large, fatty meals right before bed.